Did you know that according to research done at Johns Hopkins University, there are over 100 different types of autoimmune diseases? And not just that, but these diseases affect about 23.5 million Americans, and nearly 80% of those are women. On today's show, we're going to discuss these autoimmune conditions, their symptoms, their treatments, as well as answer your healthcare related questions here on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hello, and welcome to Ask the Doc, no appointment needed, the show where we answer your healthcare related questions. My name is Dr. Kamaljit Kaur, and I am a board certified primary care physician here in beautiful South Florida. It's great to have you join us, so let's get right to our questions. The first one comes to us from Dana, and Dana has emailed us asking, a question that I get all the time. What exactly are autoimmune disorders? Thank you for your email, Dana. Thank you for reaching out. As we mentioned earlier, there are over 100 different types of autoimmune disorders. So listing them all would take forever, right? But what we want people to know is that these are diseases that can affect almost any tissue or any organ in your body, depending on so many factors, factors like genetics and your own immune system and how it would malfunction essentially. So what different types of parts of your body do autoimmune diseases affect? Let's go through them a little bit because there's several main ones. So your joints, a lot of autoimmune diseases do affect joints by either inflaming them and causing swelling and pain even. Then there's muscles, skin, blood vessels can also be affected by autoimmune diseases. And did you know your digestive tract can also be affected by autoimmune diseases? The endocrine system as well, and the nervous system. So essentially, an autoimmune condition is one in which your own immune system overreacts or is triggered and mounts this massive response and mistakes otherwise healthy cells and tissues as foreign bodies. So it wants to get rid of them. For some reason, it does malfunction and causes a bunch of inflammation, a bunch of damage. And because it can affect a variety of organs and tissues and cells in the body, the symptoms that you're going to get from this are very different, or they can be very different, even between individuals who have the same disease. Now, like I mentioned, this autoimmune response, this attack can result in a lot of inflammation, and that is what generally gives the symptoms that we see in autoimmune diseases. While I'm not going to list all the autoimmune diseases that are out there, there are a few main ones that I do encourage people to know about and be vigilant of, especially if they're having certain symptoms. Some of these are rheumatoid arthritis, that's a very commonly known one. Then there's lupus, or the proper name for it, which is systemic lupus erythematosus. There's something called Sjogren's disease as well. There's a condition called scleroderma. Did you also know that diabetes type 1 is actually an autoimmune condition? Then there's thyroid-related conditions like Hashimoto's thyroiditis. Inflammatory bowel disease like Crohn's disease, ulcerative colitis, those are autoimmune conditions. Psoriasis, which is a common skin condition, especially down here in South Florida when it gets quite humid, it can cause flare-ups of psoriasis. That's an autoimmune condition that we see a lot of times. And celiac disease is also another autoimmune condition. So as you can see, there's a lot of them. If you're ever having symptoms and you're curious about whether or not you have an autoimmune disease, the first step is to always consult with your doctor. So let's move on to the next question. This one comes to us from Judith, and Judith has emailed us with it asking, hi, my doctor says I have rheumatoid arthritis, but I'm in pain each and every day. I take the medication, but it does not work. Every day, it's in a different part of my body. It is the worst pain I have ever felt. At times, I can't get out of bed. I use hot and cold, but nothing works. Judith, thank you for reaching out. And I'm so sorry that you're experiencing this. Autoimmune diseases can be quite frustrating because sometimes trying to manage them and trying to treat them is like trying to hold sand in the palm of your hand. You try as much as you can, but sometimes you just can't get it all. Now, rheumatoid arthritis, like many autoimmune diseases, can be difficult to control. In fact, you may even need to trial and error different types of medications to really get to that right regimen for you. There's a lot of medications that are out now, and one medication which may work for somebody else may not work for you. And I know it can be frustrating, but sometimes getting through that trial and error process is going to be important to really get to the best medication for you. Now, in addition to medications, there's also lifestyle factors that can help. Medications do play a crucial role, but lifestyle factors such as eating a healthy diet, getting enough sleep and exercise, staying hydrated, these things can certainly help control your rheumatoid arthritis symptoms as well. Now, some things to consider is that regular physical activity is very important in individuals who have rheumatoid arthritis. Doing this keeps your joints lax, it keeps them mobile, it keeps them moving. Have you ever heard of the phrase move it or lose it? That's very true when it comes to arthritis and especially rheumatoid arthritis, because the less you move, the more your joints and your muscles are going to stiffen up and be prone to disease and inflammation. The more you're moving them, the more they're going to get stronger and they're going to be flexible. So the less prone to disease and injury that they're going to be. Then there's also things like reducing your stress. In fact, studies have shown that reducing your stress does improve symptoms of rheumatoid arthritis, as does getting an adequate amount of sleep each night. I know it's seeming difficult to achieve and seeming like a big mountain to climb, but I assure you that by doing these things slowly and working with your physicians, you'll get to a place where your disease is controlled and you can otherwise live on a pain-free basis almost daily. All right, let's get to the next question. This one comes to us from Bill, and Bill asks, I've had terrible pains in my abdominal area lately and made an appointment with my doctor. When I told my friend, he mentioned he had something similar and he was diagnosed with Crohn's disease. What should that, excuse me, what is that and how concerned should I be? Thank you for your email, Bill. It's a great question because Crohn's disease is actually quite commonly known now. But before I go into details, let's watch this short video for some more information.
So if you smoke and you're diagnosed, now is a good time to quit. Crohn's disease can affect any area in the GI tract, but it's mostly found in the large and the small intestine. It can also be confined to one area or found in multiple segments. Symptoms can range in severity, and it can depend on the area of the GI tract that's affected. You also may experience periods of remission when you have no symptoms or issues at all. The symptoms can come on gradually, but they can also show up suddenly. And these can include diarrhea, fever, fatigue, abdominal pain and cramping, blood in your stool, mouth sores, reduced appetite, and weight loss. If your Crohn's disease has caused fistulas or inflamed tunnels in the skin near the anal area, you may notice pain or drainage. And in more severe cases, you may have inflammation of the eyes, skin, joints, liver or bile ducts, kidney stones, and anemia. In children, it can delay growth and development. Over time, Crohn's disease can lead to other complications, including bowel obstruction, ulcers, fistulas, anal fissures, malnutrition, and other health problems. It can also increase your risk for blood clots and colon cancer. Now, having these symptoms doesn't automatically mean you have Crohn's, but if you're experiencing anything that concerns you, it's a good idea to make an appointment with your doctor.
That was quite an informative video. And as you can see, Bill, Crohn's disease has a lot of factors to consider. Now, the abdominal pain that you're experiencing may not necessarily be Crohn's disease, but I do want to emphasize what Crohn's disease is and what to look for when you do have it or if you think you have it. So essentially, Crohn's disease is an autoimmune condition. It's within the umbrella of autoimmune diseases called inflammatory bowel disease. In inflammatory bowel disease, or IBD as we more commonly call it, there are two main groups, which is Crohn's disease and then ulcerative colitis. Now, these affect different areas of the GI tract in different ways and to different extents. There's so much that goes into it. But when it comes to Crohn's disease, as mentioned in the video, it can affect almost any part of your digestive tract and then even organs and tissues that are outside of the digestive tract. So for instance, uveitis, which is inflammation of a part of your eye, is commonly seen in uncontrolled Crohn's disease. Now, while we don't know the exact cause of Crohn's disease, like with a lot of autoimmune conditions, we do know that there are several factors that play a crucial role in determining whether or not somebody is going to develop this. For example, genetics. Genetics is very important and it's present in a lot of diseases, if not all diseases. So if you have a family history of Crohn's disease or of ulcerative colitis or any kind of inflammatory bowel disease, you should get screened for Crohn's disease if you have certain abdominal symptoms. So another important factor is how healthy is your gut microbiome? How healthy are you eating? Are you introducing a lot of processed foods and inflammatory foods in your diet? Because even in individuals who don't have Crohn's disease or who don't have any genetic predisposition to Crohn's disease, eating processed foods and inflammatory foods can cause inflammation in the gut and lead to several different types of symptoms. Also, are you getting enough restorative sleep? Now, I know I mentioned this a lot, but sleep is really important. That's when your body is re-energizing, restoring itself. Those mechanisms are actually firing on all ends to make sure you're healthy and ready to take on the day when you wake up the next day. Lack of sleep can increase inflammation in the body, and then anybody who's predisposed to inflammatory bowel disease or Crohn's disease, that can certainly be a risk factor for. Now, that being said, I do again want to reassure you that not all abdominal pain is Crohn's disease. It can be a variety of other conditions. It might be something very simple, but either way, you want to get it checked out. You want to talk to your primary care physician about it and really get the testing done that's necessary to get you the answers that are necessary so that you can get the treatment that's necessary. I hope you feel better soon. All right, we still have time to answer your questions, and it's really easy to send them in to us. So here's how you can do that.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Our next question comes from Caroline, and she has emailed us with this one. Caroline asks, can any of the dozens of autoimmune disorders be cured, or are we forced to deal with them our whole lives? Great question, Caroline, because I know this is something that is on everybody's mind when they are diagnosed with an autoimmune disease, or if it's something that runs in their family. Unfortunately, autoimmune diseases, for the most part, are not curable, but they are treatable and manageable. I don't want to discourage anybody, but it is true that we can't cure them. Now, medical research has advanced, and we now have several different types of amazing medications that can help with these diseases. They can help with the symptoms, reducing the inflammation, and preventing them from progressing and causing complications in our body. Remember, as I mentioned earlier, medications are really important, but lifestyle factors are important as well. So if you have an autoimmune condition and you're looking to manage it or treat it appropriately and essentially try to be symptom-free, not only do you want a good medication regimen, but you want a healthy lifestyle as well. I hope that answers your question. All right, we just got another question, and this one is from Julio, and he reached out to us through Facebook, so thank you for that. And Julio asks, I've had rheumatoid arthritis for several years, and sometimes I notice that it will flare up out of the blue. Could foods I'm eating be making it worse? Oh, Julio, you have touched on one of my favorite subjects. Absolutely. Foods that are inflammatory, as I mentioned a few minutes ago, can certainly worsen your rheumatoid arthritis. Processed foods, sugary drinks, fried foods, refined carbs, and red meat even can promote inflammation in the body. And if you're somebody who has rheumatoid arthritis, your body's already at an inflamed state at baseline. So you add on something else that's going to cause more inflammation, that is certainly going to make your symptoms worse, your joint pain worse, your joint swelling worse. And they do this by promoting the release of what are called cytokines. Now, I know during COVID, a lot of people learned about cytokines, and that word was thrown out a lot. Basically, cytokines are the part of your immune system that are pro-inflammatory. And I know that may sound bad, but when they're doing their job right, cytokines actually help keep you healthy. However, in somebody who has an autoimmune condition, this response is exaggerated and the cytokines can sometimes promote unhealthy inflammation. So going back to those unhealthy foods, they're releasing or promoting the release of cytokines, and then it's inflammation on top of inflammation. Now, I don't want you to concentrate on what you shouldn't be eating. I'd rather that you focus on what you should be eating, because sometimes it's easier for our minds to accept what we should be doing instead of taking out something and thinking negatively about it. If it makes it easier for you, I want you to tell yourself that maybe eating one healthy thing a day that you didn't do before is going to be what you're going to do for the next several days. And by doing that, you're going to build onto a healthy lifestyle. And when it comes to foods, you can even make a list of what foods you like and what foods are anti-inflammatory and use those. Now, to the question of what foods are anti-inflammatory, there are a lot of anti-inflammatory foods out there, but when it comes to autoimmune diseases and rheumatoid arthritis in particular, unfortunately, we just don't have the studies that have proven that one food is better than another. But there are a few studies that show that fish oil in high doses can actually reduce the inflammations and symptoms of rheumatoid arthritis. Now, as I always say, whenever you're going to take a supplement or increase your intake of anything, whether it's a food, a drink, and definitely a medication, you want to check in with your physician. And in this case, you want to check in with your rheumatologist to make sure that this is something that you can do safely. Is it even needed for you? And how it can benefit you. That being said, it's always a good idea to incorporate a healthy diet into your daily regimen. Now, the Mediterranean diet is also one that's heart healthy and overall good for being anti-inflammatory. All right, guys. So there's a lot of ways to send in your questions. And if we don't get them answered today, worry not, because you can always send them in through our service called Ask Hanna, where nurses are available to help you answer them.
Looking for a fast, free, and convenient way to get expert health advice? Ask Hanna. Ask Hanna is your go-to telemedicine service provided by the Health Channel. Whether you have questions about your health, need advice on wellness, or want to know more about medical conditions, Ask Hanna has you covered. From the comfort of your home, you can chat live with a health advisor, check your symptoms, and learn possible causes, and browse through a library of health articles. So why wait? Visit askhanna.tv today and take control of your health with Ask Hanna. Your health, your way, anytime, anywhere. Ask Hanna, your trusted health companion.
Our next question comes to us from Ainsley, and Ainsley reaches out to us from Instagram. Thank you for watching. Ainsley asks, what causes psoriasis and what makes it flare up? So psoriasis is probably one of the most frustrating diseases and can be difficult to control. It's a chronic inflammatory skin condition in which your immune system cells, for whatever reason, attack otherwise healthy skin cells and tissues. And it can show itself in different forms. In fact, there are different forms of psoriasis as well. The most common being chronic psoriasis, chronic plaque psoriasis. Now, the thing about psoriasis is that, yes, it's known as a skin condition, but it can also affect other parts of your body. You may have heard of psoriatic arthritis. So that's something that can occur when psoriasis becomes uncontrolled and complicated. Now, excuse me, like many other autoimmune conditions, lifestyle factors really help manage psoriasis as well, and they can actually contribute to its formation and development also. And did you know that psoriasis, there are many medications that are out and it is quite manageable now. So what you want to do is get it checked out by your primary care physician or your dermatologist, because the sooner you get it checked out and get it caught, the sooner you can start treating it and prevent it from getting complicated. All right, let's get to the next question. And this comes to us from Brian, and Brian is reaching out today via YouTube. Brian asks, my niece was recently diagnosed with lupus. Can you tell me what that is and what her long-term prognosis is? Our family is very distraught. Hi, Brian. Thank you for sending in your question. And I'm sorry you and your family are going through this. This can be quite disturbing, this diagnosis, and mostly because there's so much that can happen with lupus. Now, lupus, also known as systemic lupus erythematosus, is a chronic autoimmune condition that can affect virtually any part of your body. It can result in a variety of symptoms that can be minor to something that can be major. So you could just have some random joint pains or even joint swelling to something as major as damaging your vital organs, because lupus can affect your heart, it can affect your lungs and affect your kidneys, et cetera, et cetera. And though trying to manage lupus can sometimes feel like that sand in your palm that I talked about earlier, there are ways to do it. And like with many other autoimmune conditions, treating and managing lupus really depends on finding the right regimen of medications, tweaking them, the doses, how often you take them, really to tailor your disease process and to help control it. Now, again, with medications, you always want to encourage healthy lifestyle habits as well, so you can continue to live a productive life and hopefully minimize those symptoms. Now, the thing with lupus is it can affect a lot in your body, and it's random and it's unpredictable. And that's kind of what makes it frustrating, even for physicians to treat. Because of that, we do recommend frequent check-ins with your physicians. Now, this includes your primary care physician, your rheumatologist, and it may even require the input of a multidisciplinary team. So maybe a nutritionist, maybe a physical therapist, and even a pulmonologist. As I mentioned, it may also affect your lungs and other organs. So you want to make sure that you have a good team on board, that they're all collaborating to make sure that your niece's condition is well controlled and is not really disrupting her life too much. The other thing about lupus, and I know it can be scary, because lupus does have a higher risk of a lot of other disease processes, a lot of cancers, the risks increase in people who have lupus. And it's unpredictable. Like I keep saying, that's what makes it so frustrating. But you know what? I want to reassure you that we've gotten better with the research, we've gotten better with the medication. So you really want to check in with your physicians and get the right treatment for your niece. I wish her well. I hope that they can get a handle on this and she can live a long, healthy, and happy life. Let's get to the next question. All right. This question comes to us from Kevin, and he writes, are there symptoms that are common in autoimmune diseases? What would be some red flags to share with my doctor? That's a great question, Kevin, because we've talked about a lot of autoimmune conditions today, and you may be thinking that some of them have similar symptoms, and that's true. Some of them can. That's what also makes it difficult to really say, hey, this might be an autoimmune condition, or this might be an X, Y, and Z condition. So what are some of these symptoms that you may experience or that we see commonly throughout the spectrum of autoimmune disease? One of them is unexplained and or excessive fatigue. So feeling tired all the time and you just don't know why. This can be a sign of a lot of diseases, sure, but autoimmune diseases is one of those that's usually in the top 3 to 5 as a physician when somebody comes in and tells us they're experiencing it. Another symptom that we commonly see are recurrent and random joint pains and joint swelling. So if you're experiencing joint pains, joint swelling in your wrists, in your joints, your knees, your elbows, especially if it's not just pain, but also swelling, you want to make sure that you check in with your doctor because that's a symptom that could be representative of an autoimmune condition. Recurrent rashes are also something that we see quite commonly in individuals with autoimmune disease. Unexplained numbness or tingling. As I mentioned, with a lot of autoimmune diseases, they do affect a variety of organs and mechanisms in your body, and the nervous system is one of those. And when that happens, then you can experience some numbness and tingling. Then there's symptoms that you may not have actually heard of very often, but we see it often, and that's a really dry mouth or really dry eyes. Now, I'm not talking about just, once in a while you might get a dry eyes or you might get a dry mouth, but this is something that reoccurs on a regular basis and just doesn't go away. No matter how much lubricating eye drops you apply or how much water you drink, you're still feeling very parched and very dry. While there's a lot of symptoms, these are some of them. So thank you for sending in your question, Kevin. All right, we still have time to answer some of your questions, and I would love to show you how you can send them in to us. So here's how you can send us your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
So this next question came to us through a phone call. Kathleen called in and she asked, How can I get help with ringing in my ears? Hi, Kathleen. Thank you for sending in your question. This is a great one because I know a lot of people experience this. I get it all the time as a physician in my primary care office. Why is this ringing going on in my ears, and what can I do to make it go away? Now, with ringing in the ears, it can be just as frustrating as an autoimmune condition because there's so many reasons that it can happen, and there's so many ways that we can treat it. Point being, when you're experiencing ringing in your ears, the first thing you want to do is check in with your primary care physician, because it might be something as simple as an excess build of earwax in your ear. You take that earwax out and your ringing might go away. So it might not be anything drastic, but it also might be something a little bit more complicated, like an infection, reduced blood flow to that part of your ear, or a disturbance in your inner ear mechanisms. Point being, you want to get checked out. You want to see what the cause is, because when you know what the cause is, that's when you can best treat your ringing in the ears. It's also important not to do anything yourself. You want to let your physicians take care of it. All right, folks. Unfortunately, that's all the time we have for today. Thank you for sending in your questions, and I hope to see you here next time on Ask the Doc. No appointment needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Looking for a fast, free, and convenient way to get expert health advice? Ask Hanna. Ask Hanna is your go-to telemedicine service provided by the Health Channel. Whether you have questions about your health, need advice on wellness, or want to know more about medical conditions, Ask Hanna has you covered. From the comfort of your home, you can chat live with a health advisor, check your symptoms, and learn possible causes, and browse through a library of health articles. So why wait? Visit askhanna.tv today and take control of your health with Ask Hanna. Your health, your way, anytime, anywhere. Ask Hanna, your trusted health companion.